You're listening to a podcast developed and produced by the Association of Asian Pacific Community Health Organizations, AAPCHO. To learn about AAPCHO, its members, or the principles and values that have guided this organization's work for more than 20 years, please visit www.aapcho.org.
Serving Locally, Leading Nationally is AAPCHO's latest podcast series, observing this year's theme for National Health Center Week. This series celebrates the crucial role of community health centers in providing high-quality healthcare and community development opportunities to many of the most medically underserved populations across the United States. Dr. Chen is a current board member of the California Endowment and former board chair of the Asian and Pacific Islander American Health Forum. In this episode, Art speaks with AAPCHO's Director of Communications, Stacy Lavilla, about the rewards of working in and the importance of addressing workforce development issues at community health centers.
Dr. Chen, you have had a long and extensive career in public health, from being a family physician in a community health center to being an officer in the Alameda Public Health Department. You have had many different perspectives on the field of public health, and with that said, why is the community health center such a special place?
In its ideal, it's a place where you can go to serve community and do exactly what you dreamed of doing, if that's what you dreamed of doing when you went to medical school, or to nursing school, or to dental school, and so on and so forth. And in addition to that, community health centers, it's the laboratory for creativity and innovation. There are just enormous number of opportunities. Health education, research, teaching, advocacy. Community health centers are known for doing all of those things. There's no limit to the type of partnership you can develop out of a community health center, and now coming into them, it offers quite a variety of career paths, and but most importantly, in the end, it's really all about expressing your values of compassion and care for people who are underserved.
What would you say the biggest rewards for you over the years working at CHC?
I think for me, personal fulfillment, being able to say that I went into medicine with certain ideals. I was able to actually practice them. Mm-hmm. And so the intellectual and the kind of additional fulfillment was deepening the understanding of the complexities of all these problems, so that we can develop better strategies that were going to have much more impact and influence, while at the same time we're providing, high-quality care.
Let's talk a little bit about workforce development and shortages. Why do you think it's so important for us to address this issue right now?
Communities feel comfortable when they can walk in the door and see someone that looks like them. Definitely first impressions and preferences, are with people that you feel comfortable with, because you assume they share that some kind of similar background. And as long as we have barriers that prevent people from accessing, whether they're financial barriers, cultural barriers, language barriers, it's going to be hard enough to reach out to people to get them to come in and engage in prevention and the health system. And if we don't pay attention to the workforce diversity, we're just going to make it even harder. Mm-hmm. The more diverse our workforce to meet the diversity of the local population, whatever it is, the better. Having said that, it doesn't mean that just because someone looks the same that they're going to be that compassionate, sensitive provider that speaks the same language. So it's more than diversity. It's about diversity and in our training systems that really pay attention to screening in people that have a compassion, that have a commitment, that have a way of communicating that is inviting rather than intimidating. Mm-hmm. So workforce diversity, yes, it's really critical. And just as important is maintaining a lot of the positive values that we want to see in our healthcare professionals. And I feel like community health centers, a lot of them are models, and they take pride in being those models, and they try to reach out and have type of programs, pipeline programs of students, whether they're undergrads or whether they're health profession students, constantly coming through internships and things like that, and even residency programs to influence the people that are coming out, so that they'll have the full embodiment of the ideal health professional that any of us, I think, that we would want to see.
Can you point to any good community health center pipeline or recruitment models that you've seen?
Yeah, we're working on one right now that's about 3.5, almost 4 years old at Asian Health Services. And when I was in New York at the New York Chinatown Health Clinic, they actually had one of the outstanding programs called Project Ahead. But I think all the good models, they all have similar ingredients. Mm-hmm. They reach out to students and capture the idealism that the students have. They share information with them that educates and exposes them to a lot more than they ever imagined. They expose them to all the social issues: poverty, bad education, lack of access, lack of opportunity, discrimination. The good programs will expose, I think, a lot of that, and then they expose students to models, to positive models, so you don't get lost in all the overwhelm of what we're facing or what our patients are facing. They see positive role models who are there doing what the student feels like they want to do, and have a chance to interact with them, learn the upsides and the downsides, because it's tough. No matter how tough it is, at the end of the day, you feel this amazing, fulfillment. So those are the ingredients, I think, in models. I think the more a pipeline model, gets real, what happens to a patient as they go, negotiate through the health system and all of that information and exposure is extremely helpful. The other thing I think that's really good about these pipeline programs is if they offer some element of leadership development. I think that's another element that is really helpful.
Dr. Chen, thank you for sharing your experience and your knowledge with us.
Thank you.
This podcast was brought to you by AAPCHO. Please join the conversation on our Facebook fan page at facebook.apcho.org and tune in for our next podcast at www.aapcho.org.